Chair, and I'm over here. So if I look like I'm looking off in the distance, I probably should take myself off camera just in case, but it looks like I'm looking off in the distance. I'm looking at my other monitor. So thank you all for having me today. It's great to be here with you and to talk about this. I really appreciate the level set at the very beginning to just kind of lay this out for everyone and make sure everyone, Kaylan had a very good understanding of what's happening with Medicaid transformation, a lot of information and a lot of detail for people to process and take in. So we are very pleased to be here and share with you a little bit about our plan. I am going to be very mindful of the time and move through this as quickly as I can. As you've heard, that there is a number of things that are going to be consistent across all of the health plans. We're all going to be offering the same services that you already receive. We all are going to be offering benefits that are over and above the services that you currently receive with your Medicaid services. Those are referred to as our value adds. And so I'm going to introduce you a little bit to Carolina Complete Health and then talk a little bit about some of our value adds, but I'm going to be relatively brief and try to get us through so that everyone has an opportunity to tell you about their plans. So Carolina Complete Health, we are a program, a health plan that is new to the state of North Carolina. We are not new to healthcare generally. We have a very long history of providing healthcare services. We are partnered with a couple of organizations here, key organizations here in North Carolina that make us very unique and focused from a provider-led perspective. We are in collaboration with the North Carolina North Carolina Medical Society and North Carolina Community Health Center Association. We are also part of a larger corporation that serves the entire USA. There's representation in all 50 states and health plans there, which we draw on for our support and services and the expertise. So we have an extensive expertise with the providers who are working with us both here in North Carolina and across our corporate entity. We are experienced in Medicaid, Medicare, and in the marketplace. So we are really looking forward to serving the Medicaid population here in the state of North Carolina. We are unique not only in that we're provider-led and our partners are really key providers of Medicaid services here in the state, but also in that, unlike the other health plans, we are regionally focused. We're going to be providing services in regions 3, 4, and 5 throughout the state only. So we are small and looking forward to the ability to really focus in on the services that we're providing to the members as part of our plan. This is a short list of some of the services that will be provided. It is not at all exhaustive, but it gives you some indication of what's provided. I won't go through all of them, but I will spend some time focused on some of the key, which are the home health and the personal care services that are available, program for asthma, diabetes, high blood pressure, and other chronic disease, as well as mental health and substance abuse services among the others that are there. So I'll move into our value added services again, wanting to be mindful of everyone else who has yet to present to you. So just really quickly, we have a number of benefits. Again, this list is not going to be exhaustive. It will give you some indication of some of the benefits that are available. These include education supports for children as well as adults who may be seeking their GED or the alternative equivalent to their high school diploma. There will be supports there for both groups, adults and children, up to $75. There is a vision benefit as well. There are eligibility criteria for some of these, so I want to make sure that parents and adults are mindful of those. The vision benefit is available up to $125. Again, checking the eligibility benefit, that is for individuals 21 and above. There is also a support for new mothers, pregnant mothers, mothers at risk. And there are a number of benefits here, some of which include diaper bag, breast pumps, and some of the other items that will be needed, car seats and the like. We'll be doing events in the community as well that will include baby showers and things like that for pregnant and expectant moms. With regard to engaging children in activities, we have a benefit here for children between the ages of 6 and 18. It will be really a wide range of services that will be available to children, whether it's an interest in museums, an interest in the 4-H club, an interest in sports, or other activities after school. There'll be a wide range in which parents can choose from depending on the needs and interests of their individual children. $125 benefit will also be available for healthy foods. That'll be through our partnership with Walmart, and that will be accessible for every member, no eligibility criteria there. And then there's cell phone services with up to 250 minutes with free talk and text, which will allow you to stay engaged in consistently in touch with your providers as well as your care managers. Moving forward, there is an over-the-counter benefit up to $120 that will get you any number of items in your local over-the-counter drugstore. You can pick up those items there. With regard to health and health care, we have Weight Watchers. That's up to 14 weeks, including online tools for persons who are looking to improve their health through weight loss. We also will be engaged with the YMCA and offering disease prevention programs through that organization as well. And then there'll be some healthy reward benefits that will encourage members to go to their WellCare visits, go to their routine and annual physicals and things of that nature to promote ongoing health and well-being amongst our members. Additionally, there are some other benefits here. Transportation, as was spoke to, that is a benefit that you currently have. It will shift now to our local providers. Again, Christy spoke to what those are. Motive Care or One Call will be the providers for the PHPs. We are expecting as well that we'll be offering benefits of additional education supports for children, supporting housing needs, as well as food and nutrition, and offering language assistance to any member who may require or need that. Our mission generally is really whole person health. We're really striving to address all of the factors that influence the health and outcomes of individuals. That include their physical, emotional, as well as the social and non-medical drivers of health. So we're looking at whole person health, and we're really looking to do that in our local communities, one individual and one person at a time. Finally, I just want to leave you with information about our plan. Thank you again for having us. We really appreciate the opportunity to speak and share this information with all of you. Paige, would you like to go next?
What did you say?
Would you want to go next for United Healthcare?
Sure. I had a feeling you were going to choose me. Let me start my video. Let me go ahead and share my screen. Give me a second. Let's see. All righty. Can everybody see my screen?
Yes.
Great. So let me get the slideshow going. All right. Good morning, everybody at Smart Start. I'm so excited to be here today. I'm so glad that you invited all of us to come along and talk to you a little bit about what's happening with Medicaid in North Carolina. And one of the things United Healthcare knows is that the first 2,000 days are the ones that matter the most. And we really do appreciate the work that you're doing out there in North Carolina with our kids. Let me introduce myself. My name is Paige Hales, and I am the Community Collaboration Advocate with United Healthcare. So the name of our health plan is called the United Healthcare Community Plan. We've been in North Carolina for 27 years. And this is our mission: helping people live healthier lives and helping make the health system work better for everyone. And these are our core values: integrity, compassion, relationships, innovation, and performance. And relationships, I think, is probably, I'm going to say up there on the top there for the core values for me. So one of the things I don't think has been noted yet, what I imagine probably Carter is going to talk a little bit about, is some important key dates that are happening right now in North Carolina with Medicaid managed care. So right now we're in open enrollment. And on May 15th, the auto assignments are going to begin. That's when the beneficiaries are going to be dropped into a particular health plan. I think that's going to happen via an algorithm. On July 1st is the big day. That's when NC Medicaid Managed Care goes live, and that's when our beneficiaries can start using their benefits. Another good thing is we have what's called a choice period, and that's where if a person doesn't like the health plan that they're using, that they can switch to another one. They have 90 days to do that. And the choice period ends on September 29th. So this is one of my coworkers. We have community collaboration advocates throughout the entire state. This is our website, and this is the number that our beneficiaries can call if they have information about, if they want information about United Healthcare. So I do want to go over our extra benefits. I'm not going to spend a lot of time on these. These are just some of them. In regards to education, we have life skills training and 3 round-trip employment rides. Members 18 and older can get free GED exam vouchers and materials up to $160. For prenatal, we do have free breast pumps and gifts and reward for you and baby by completing prenatal and postpartum doctor visits. We have up to $75 yearly in rewards. We have a 13-week vouchers for Weight Watchers. We do have a $75 yearly for youth club memberships, either the Boys and Girls Club or the YWCA. Some other things is we do have some value in alternative healing, massage therapy, and acupuncture. We're going to give up to $150 for mattress covers and pillowcases. We have a free cell phone. This is the one that I like the most. I like the free prepared home delivered meals after a qualified hospital or nursing facility stay. The reason why I like that is because I know I've been in the hospital a couple of times, and it would have been nice to have somebody deliver some meals to me. And we also have a free mobile app that connects SNAP accounts. So this is our team in action, and I do want to talk to you a little bit about how we can partner with you at Smart Start and your partnerships throughout North Carolina. So this is us out in the community, and here's some of the things that we've been doing recently. So last week, I was invited to a Kaleidoscope Play and Learn group. And I was able to talk to a lot of parents at that, and Brunswick County and the Brunswick County Partnership for Children had invited us to come along and to the play group, and it was really good to speak to everybody. Another thing that we can help with is we can maybe partner with you at your family fall festivals. Or another idea is I do know that you do some backpack programs for kids entering into pre-K, and we can help you with goodie bags there. So those are just some of the things that we can help with. And if you would like to give me a call, I can hook you up with all the other community collaboration advocates within the state and your region to help you get the word out to your parents that Medicaid transformation is happening. And that's it. Thanks.
Thank you. All right, Shadana, it's you. You're wrapping up for the plans before we'll kick it over to Carter.
Sorry, my phone did not want to unmute, but thank you guys so much for having us here. I know this has been a lot of information, so I'm going to try to be really quick and kind of just go over who AmeriHealth Caritas is. So my name is Shadana Head, and I'm the community educator for Region 5 in North Carolina. But I'm glad to be here as we have community educators all across the state. So I'm glad to be here presenting. So we are AmeriHealth Caritas. So AmeriHealth Caritas is part of an AmeriHealth Caritas family of companies. And we were founded in 1984. So a lot of folks don't know our name here in North Carolina, but we have been in managed care for over 37 years. We started out in the Philadelphia area, which is where our corporate office is. And we kind of got started because the Sisters of Mercy from Mercy Hospital realized that folks were coming to the ER for primary care, that's not what emergency care is for. So they realized that folks were doing that because they couldn't afford health care or couldn't afford health care insurance. So our mission is to help people get care, stay well, and build healthy communities. And our vision is to be the national leader in empowering those in need. So we are in 13 states, including the District of Columbia. We have over 4 million members and about 8,000 associates. So we are in all 6 regions. I don't know if you guys have seen this map, but this is kind of how we are divided throughout the state of North Carolina, and AmeriHealth Caritas serves all those regions. So what is managed care? They have already explained this to you, so I'm not going to go over it, but the overall goal is to reduce overall healthcare costs and promote better health outcomes. This was actually put into effect in 2015. So they passed the legislation in 2015. And on this long journey, we are finally almost at go live, which will be July 1st. So preventative care is our top priority. So we'll be helping members focus on getting their BMI measurements, their physicals, their screenings, mammograms, wear child checkups, and so on and so forth. So our goal is to gain contracts with providers all across the state. So whenever they say in that letter that folks are receiving in the mail to pick a provider first, that's because we want to make sure those members pick the plan that their provider is contracted with. So of course, I know as well as all of the other plans, our goal is to have a contract with every provider all across the state. Unfortunately, that's not going to happen before go live. So we really want to make sure they connect with the enrollment broker to make sure they're picking the right plan for them. So individuals, as they said, that do not choose a plan will be auto-assigned. So we are in open enrollment now. It ends May 14th and auto-assignment begins May 15th. The great thing is they are getting that 90-day period to change their plan if they're not satisfied with it. So that's why we're really screaming from the rooftops to please pick your plan, because we want folks to make their own choice. So as everyone stated, all of the Medicaid mandatory benefits will be covered. So nothing is changing as far as what's covered by Medicaid. The only thing that is changing is that instead of being directly through the state or through the county, it'll be through one of the plans. They're going to also make sure that we cover some of those additional benefits like vision and hearing, prescription services, mental health and behavioral health, and transportation to all of their appointments. So some of our value-added services or value-added benefits are that additional vision benefits for adults, asthma navigation, a care card, which will be loaded whenever they do those yearly appointments or physicals or mammograms up to $75, a flexible recovery benefit, high-risk pregnancy services, a Living Beyond Your Pain program, post-discharge meals, like Paige says in their plan. We also have those discharge meals that come directly to the door whenever they discharge from the hospital, so on and so forth. We also have some of our benefits really following those social determinants of health, which includes Boys and Girls Club memberships, Mission GED test prep, SafeLink wireless cell phones, WW, or what people know as Weight Watchers memberships, et cetera, et cetera. So we are also very involved in the community as well. So AmeriHealth is really big on community involvement. In some ways we'll be doing that we'll have wellness centers in each region across the state. So at that wellness center, we will also be holding educational classes like diabetes management, high blood pressure, fitness classes. That's where we'll have our baby showers as well, where we'll be giving those members diapers and diaper bags and packing plays and car seats. And we'll also be really working closely with our community partners to provide services for the member. We really want to help the member focus in and hone in on those social determinants, because we know that folks don't have health care as a top priority if they're not focusing on those other needs as well. So we will also have people like me across the state, people like community health navigators that'll do home visits and things of that nature. We'll have care management services where we have nurses, et cetera, et cetera. We also have care crew volunteers. So what that means is employees that work for AmeriHealth is required to volunteer to work for the company. So we set up different care crew events across the state as well, where we have employees sign up and do volunteer hours at different agencies. So for example, before COVID hit, we were really out and about, but one of the things that I set up was supposed to be at the Habitat for Humanity, and we had about 20 employees go out and help build on homes. So that's just an example of some of the care crew, on top of going to food banks and things of that nature. So how Carter will go over this, but how you apply for Medicaid and how you recertify your Medicaid will stay the same. You will still go do that through DSS, and all of that contact will initially still stay there. Once they qualify or once they recertify, then that's when they'll pick a plan. So I will put my contact information down in the chat. So like Paige said, if you ever want us to partner with you guys, to educate your staff, to educate the parents, to educate the community, we can do that. We also, like I said, work with you guys on different events, sponsorships, and things of that nature. And we work really close together as plans, surprisingly, because most people say we're competition, but we really want to focus on the member, not what we offer. We want to make sure the member have all the information they need. So if you have an area that you want us to cover, to do an event where we all can be there and give them information as well, you can contact any of us and we can come together for that. So thank you. I tried to be quick, but thank you. If you have any questions, I'll check the chat.
Thank you so much. All right, now Carter Wade from the Enrollment Broker's Office is going to walk us through a lot of what has already come up as kind of the how to enroll and pick a plan, and also the services that the Enrollment Broker offers folks.
Awesome, great, thank you. I'm going to share my screen. Just one moment. I had this correct, let's see. Okay. Just one moment, trying to get everything lined up in the right place. Okay. All right. Hello there. Let me back up on screen. Let's see here. I'll make this as quick as I can. And thank y'all so much for being here today. And I'm going to look at another screen while this is going on. So again, I'm Carter Wade with the Outreach and Education Manager for the North Carolina Enrollment Broker y'all have been hearing about. So quick, y'all have heard about Medicaid Transformation, great information you've learned today. We also provide support for the EBCI tribal option that is also out there for the Eastern Band of Cherokee Indians. And that is covered in certain counties. Again, the timeline, that's a big piece here. Eligible beneficiaries would have received enrollment packets prior to the open enrollment period. And open enrollment began March 15th and will end next Friday, which is May 14th. And midway through open enrollment, a reminder card was sent out. All beneficiaries must enroll by the end of open enrollment period. If they have not completed enrollment by the end of the open enrollment period, a health plan will be chosen for them. On the timeline, you'll see this noted as auto enrollment, and a primary care provider will be assigned as well. So health coverage for members starts July 1st, and we really hope that people will self-select. They may change their enrollment within a 90-day window after their health plan starts. So starting July 1st, they have 90 days. And if you get questions about this, you should direct the member to the health plan first to see if there's a way to stay with the health plan. But if they want to change, there's a change request form, and they'll need to fill that out and work with the enrollment broker on that process. So who is the enrollment broker you've been hearing about? We're that third-party unbiased entity that provides a choice counseling and enrollment services and outreach and education. So we are unbiased third-party, able to assist beneficiaries. We help them understand their choices so they can make the right choices for themselves and their family. Now, what that enrollment packet they would have gotten in the mail that comes from us, from information we get from Medicaid, DSS offices, includes the transition notice, depending on what kind of notice they would have gotten, an information sheet, a health plan choice guide that shows all the plan information. And on the back of it, it has the top 10 added services. It also has an enrollment form that has already been pre-populated for them. So if they want to fax or mail that in, they can. There are multiple ways that they can enroll through our website, ncmedicaidplans.gov. They can also use a chat option. They can also download and use the NC Medicaid mobile app, which is available on Android and Apple. And also to call the call center as well. And that number is 833-870-5500, and the call is toll free. And they can also enroll again by mailing or faxing in their completed enrollment form. Now the website is designed to enhance access to program information and is compatible with the different browsers and is available in English and Spanish. The top right corner of the website, you can select Spanish or English, and that turns all the information into whatever language you've chosen. You can also change the font size on there too. And we have a chat tool as well on the bottom right of each screen. You'll see that chat option. And a little more detail about that the chat option is available in English at this time. And the chat option is a great way to get that kind of questions. All kinds of things can be answered through that option. We also have the mobile app, which again, as I mentioned, is available through Apple and Android. And it's available in English or Spanish, depending on the user preference. So people set that. And if somebody is authenticated as head of household, they'll be able to see the entire household information. And if not, they'll just see their information. But enrollments can be done from the app as well. Now the call center, we're all virtual, and this is the hours that we have now during open enrollment. They're extended hours. So they're open from 7 a.m. to 8 p.m. 7 days a week through May 14th. And then after that, it will go to 7 a.m. to 5 p.m. Monday through Saturday. So those are the hours. And again, that number is 833-870-5500. And then the TTY number is 1-833-870-5588. Now outreach, which is what we're doing right now, is the community. So we work with, I have a team of outreach specialists working with supporting the DSS offices, working with the tribal community, and I'm part of the group that does outreach into the community. So we do partner and community engagement. Additionally, we have outreach materials that are located under member resources on the website. So if you go to ncmedicaidplans.gov and choose member resources, all kinds of information will pop up, and this is towards the bottom. And this will also have tribal information, all these materials. Additionally, a recording of our 30-minute community presentations available. And if you flip to Spanish, these same materials are available along with the video as well in Spanish. Now outreach, we have events, virtual events, and this is on the front page of the website. The bottom left has meetings and events. So you would select a county and go and see what events are in that county, but the events are open to all state residents, but these are virtual. So no one has to be a certain resident of that county. Anybody can come to any virtual event. And we have a number of them going on throughout this week and next week, where we present about a 30-minute presentation. And we're also able to take requests for people wanting to have someone call them back and do an enrollment. So that's something that we started. And when you select that county, that's when you'll see this next screen will pop up and show all the different events. But now some key takeaways. You've gotten a lot of information today, a lot of great information. Some key points to remember. Beneficiaries can enroll in NC Medicaid in several ways. They can do it online, their mobile app, they can call, they can mail, or they can fax. And as far as the offering that we have now with our community events, that's would basically be a call center because we'll call them back. So answering beneficiary questions. Okay, eligibility. DSS is still responsible. They are the ones that are responsible for determining if someone's eligible, their eligibility. And any questions related to that are for DSS. Now questions related to choice counseling or enrollment, beneficiaries should be out to the enrollment broker. We can also help with mobile app and website. Now when it comes to if they're going to stay in NC Medicaid Direct, they need to contact the Medicaid Contact Center with any of their questions. Now, after enrolling, members should contact their health plan for benefits, placement cards, all that kind of stuff. But now if EBCI tribal option, or should reach out to DSS. Now, this is listing off all the plans that are across North Carolina. Not all of them are covered throughout North Carolina, but this is all of the plans and their contact information. This is a great slide if you want to take a picture of this. This is where you can see all the different plans, as well as their website and phone numbers. But again, not every plan is available in every county, but this gives you an indication. And I know that's a lot of information really quickly. This is an exciting time and really appreciate Smart Start and all making this event available. Are there any questions?
It looks like we have a couple, and since you have your screen up, I will go ahead and read them to you. So the first one from Amy is, can you get translating services for non-Spanish speakers?
When people call the call center, we have language line. So that would be my recommendation, to call the call center, and the enrollment specialist will work with the individual to get to the language line to get to the language they need help with.
Awesome, thank you. All right, the next one is, when choosing a primary care provider, are families choosing a practice, for example, Duke Pediatrics, or a specific doctor?
They can look up whatever provider, look in the provider directory. Our team could help them locate if they're looking for a particular provider or a particular office. We'd be able to help them with that process to look that up if they have an idea of who they want to go with or stay with.
Perfect. And then there was a request for, I think you had a map of where the plans are per region, and they just wanted to see if we could.
Oh, didn't have a map, but let's see, Carolina Complete. I don't know if Carolina Complete has a map or not. EBCI Tribal Option is has 5 primary counties and 6 peripheral counties. I don't actually have a map of that. But we can see about getting something like that.
Great, thank you. There's another question. What is the best way for a client to find out what plans are covered by their current providers? And I think you just kind of spoke to that a little bit.
Yeah, they can look online, they can go onto the website and look that up, or they can call the call center and we can help them see what plans their provider is with.
Great. And then there's a question of where we can find the income guidelines for eligibility.
That would be through DSS. I would direct people to the DSS of the county they live in, would be probably the best way to handle that.
Perfect. And then another question of, does choosing a plan apply to Medicaid for pregnant women, for pregnancy Medicaid?
If someone got a letter saying that they're eligible to enroll, if you're not sure if you should have gotten a letter, you're not sure if you're eligible, that may be in this case, I would suggest calling the enrollment broker with your Medicaid ID number, and we can let you know if you should have gotten a packet, meaning you're eligible, or perhaps you're exempt, but that would be the way to tell. And if you have lost your packet and need another one, you can also call the call center with your Medicaid ID number, and we can mail that to you as well.
Thank you so much, Carter. And thank you for everyone else as well for these wonderful presentations. I know it's so much information. And before we round out and kick it back over to Yvonne from Smart Start, I'm going to do one final poll, which really helps us understand how we can help you better serve the families you serve with this information, which is what are the most helpful resources to share all of this information with families? I know all the plans have one-pagers, the enrollment broker has a wonderful site, but it's just really helpful for us to know kind of the best resources for folks. And if you're saying other, if you could pop into the chat what you mean by that, because I realize the flaw in an other in this poll is that we don't know what you mean. Just a few more seconds because I know we're at time. Awesome. Thank you. So it looks like fact sheets and short explainer videos with social media in mind are really what is going to be helpful to you all. So that is really helpful to know. It's helpful for our folks to know as well. And we really, really appreciate everybody joining us today. I know that was a ton of information, so please feel free to reach out. I think everybody has put their contact in the chat, My contact information, super easy. It's Kaylan@ncchild.org. You can connect with any of us, and if it's a question for anybody else, we'll make sure to pop it over to the right person. So with that, I'm going to thank everyone again, all of our panelists, everybody for joining, and I'm going to send it back over to you, Yvonne.
Wonderful, wonderful. As you said, this is a lot of great information. Thank you to everyone. And I do want to say to all of the presenters today, if you would like us to upload your information to our website, please email to jcarter@smartstart.org. And we will get that uploaded for you. Just put a little brief message for this session and we'll make sure that it's uploaded just to this session. And I'm asking the attendees, please don't leave. Give me 1 minute and we're going to give away a prize. But I just want to say thank you to everyone. We really appreciate all this great information. Please go to our website to get additional information from this session. Also, we recorded this session. We missed a little bit in the beginning, but the information that was recorded will be uploaded as well to the website. A couple other things, we do have a sponsorship session coming up with Wonder School that we would like for you to attend. So now as my IT help gets ready to share our video, then I will announce our winner. We got just a quick little video from Lakeshore and we're going to announce that winner.
It's giveaway time, guys. It's giveaway time. Jamal here from Lakeshore. We're about to have some fun. I wish I could be with everybody right now, but guess what? If we were all together, I would be giving away some kind of goodies, some prizes, something. So that's what time it is. I hope you all enjoy. Can't wait to see you next year. Have a good one. Thank you.
And today's lucky winner is Anna Pabon. Anna, are you still with us? You may unmute if you're still with us. Let's see, did we lose Anna? Well, I know she was here most of the session because I checked to see and she's still here. So congratulations to Anna. And I will contact her and let her know that she's won a prize. Again, thank you all for attending this wonderful session. It was a great roundtable. Thank you so much for all this information. Enjoy the rest of your day. Bye-bye.
Thank you. Bye-bye.
Bye-bye.
Take care. Bye.